So this video is to help you remember the urinary A&P system. So it's going to test your knowledge. So what are the two parts of the nephron unit? Renal tubules and blood vessels. So you have your tubular component and your vascular component. What is the nephron unit? The urine-making unit of the kidney. The kidney plays a role in the regulation of red blood cells through the secretion of what? Erythropoietin. Blood leaves the kidney through what and where does it empty? It leaves through the renal veins and it empties into the inferior vena cava. Blood is brought to the kidney by which artery? The renal artery. What are the three regions of the kidney? The renal cortex, the renal medulla, and the renal pelvis. The indentation of the bean-shaped kidney is called the hilus. What is the name of the location where the kidneys are located behind the parietal peritoneum? Retroperitoneal. What is the term that refers to the study of the kidney? Nephrology. What are the organs of excretion? The skin, lungs, intestines, and kidneys. What do the kidneys eliminate? Nitrogenous waste, water, electrolytes, toxins, and drugs. What are the most important excretory organs? The kidneys. What are the three processes of urine formation? Filtration, reabsorption, and secretion. What are the plumbing structures? The ureters, urinary bladder, and the urethra. What is uremia? Urine in the blood. What is the function of calcitonin? It excretes calcium and phosphate. What is the function of PTH? It reabsorbs calcium and excretes phosphate. Hyposecretion of ADH causes which condition characterized by the excretion of a large volume of pale dilute urine? Diabetes insipidus. What is the function of ADH? It concentrates the urine. Angiotensin II stimulates the adrenal cortex to release what? Aldosterone. What is aldosterone referred to as? It is the salt-retaining hormone. The stimuli for the release of aldosterone is renin. What is the function of aldosterone? It retains salt and increases blood pressure. Aldosterone is a hormone secreted by the adrenal cortex. The excess secretion of urine is called diuresis. True or false? Glucose is reabsorbed and creatinine is not. True. If blood pressure suddenly declines, as in shock, glomerular filtration pressure decreases and causes what to happen to urinary output? Urinary output drops, so it's going to decrease. What is the name of the involuntary smooth muscle in the bladder? Detrusor muscle. What are the folds in the bladder that allow the bladder to stretch? Rugae. What are the 4 muscles of the bladder? Detrusor, rugae, trigon, and the internal sphincter. What is the difference between renal failure and urinary retention? Renal failure is where the kidneys do not make enough urine, and urinary retention is where the bladder does not expel urine. Good job!